What's up, y'all? It is Dr. Mia, your B3 specialist and board certified gynecologist at Me Bella Wellness Center, where we offer weight management, hormone pellet therapy, intimacy solutions, laser hair removal, and total wellness with supplements to both men and women, as well as, and most importantly, gynecology to women and adolescents of all ages. Our goal is to help you live well, age well, and experience everlasting intimacy. So, today we're going to talk a little bit about heart disease because it is Heart Month, and I've been a little bit off the radar, but I have been doing some really important things. Like, I just got me another degree from Tuck University, the business school. It's executive education. So, I got me another certificate from there. It's like the top three business schools in the United States of America. So, we had an amazing time there. I went to learn more because you may not know this, but it is very challenging to keep a private practice open in 2024. So we were going to learn as much as we can because we know we get the kind of care at Me Bella Wellness Center that we want to continue. We want to be able to continue to serve our patients and be one of the few private practices still open and owner operated. So, a huge shout out to all of our patients who have been coming to us for years and years and years and have continued to support us. We want to say thank you, thank you, thank you. And we want to let you know that we are doing everything we can to continue to serve you at our highest level possible. So, anyway, today we're going to talk a little bit about heart disease and how to prevent it. Y'all know it's Heart Month, it's the Love Month, all the things. So as far as heart disease goes, I think one of the most important things that I need to remind everybody of is to just go get screening. Ladies, if you go into menopause at 30, start getting your heart screenings at 30. If you go into menopause at 50, you should be getting them by 50. But make sure that by the time you're in menopause that you have had a baseline heart workup, and that includes an EKG, a stress test, and an echo. You can see your primary care doctor, or you could be referred to a great cardiologist. I refer most of my patients here in the city to most all of my patients in the city to Annabella Simon Lee and her husband Tim Lee, who are some amazing cardiologists that take great care of all of their patients. They've saved so many of my patients' lives. My patients who've gone to other doctors and been kind of written off about their chest pain or their flutters, they go see them, and the next day they're in there for open heart surgery. So they've saved, again, so many of my patients' lives. So if you have not had your heart screening and you are in menopause, no longer having cycles, had your ovaries removed, went through an early menopause, you need to get that baseline workup because when your hormones are gone and you're in menopause, that's when your heart starts to age the most. The same for men. Make sure you had that cardiac workup. Is usually by the time your testosterone starts to decline, your heart is going to age fast as well. So if you're in your late 40s, you should have already had a workup for your heart disease, and you should be getting regular screenings. Screenings include for heart disease to prevent diabetes, because diabetes worsens heart disease. Cholesterol should be screened, blood pressure should be screened, and you should have those other screenings like an EKG, an echo, as well as a stress test to see how your heart is functioning. And then, ladies, remember, heart disease to us may present differently from other people, so that's why it's so important to get your normal screenings, that you're going to your primary care doctor, controlling blood pressure. Normal blood pressure is less than 125/85. Exercise is going to protect the heart. And guess what? Intimacy is great for the heart. Men who engage in intimacy after having a heart attack decrease their risk of a recurrent heart attack by about 40%. Women who continue to have intimacy, physical intimacy, tend to live about 5 years longer than women who don't. So intimacy is important, but you can't continue to have intimacy as you age if you're not doing all the things to protect your heart. So again, keeping that blood pressure down. I know a lot of people don't like to take blood pressure medicine. With the slave trade, Black folks just got high blood pressure. The only way you could survive on a boat for that long was to be selected out for salt retention. So you're more likely to have high blood pressure if you are a Black person in America. You can be healthy, you can be normal weight, you can exercise all the time. But if your blood pressure is greater than 125/85, you need to take your medicine to decrease your risk of heart disease. The number one killer in the United States of America is not breast cancer, is not prostate cancer. It is heart disease for men and women. So make sure you're doing everything you can, keeping your blood pressure low, exercising regular, having great physical intimacy, making sure you control your blood sugars, make sure we keep your cholesterol levels down, making sure that you do all the things that you can do, like decrease the salt in your diet. And I say, everybody, just decrease sugar in your diet, because sugar has become the new devil. And I think it increases our risk for so many things. So decreasing the enriched flour in your diet, decreasing the sugar in your diet, decreasing the salt in your diet, making sure you're focusing on eating your lean proteins and your healthy fiber and your healthy grains, and minimizing a lot of your carbohydrates, because heart disease is also affected by weight. Blood pressure is affected by weight. So if you're overweight or obese, you're increasing your risk for heart disease, as well as high blood pressure, as well as diabetes and so many other diseases. So that is why a huge focus at Me Bella is weight management, because we know it's not something that's easy to do. We know it's something that's pretty hard to do. So we are here to help you with behavior modification, help you create a lifestyle so that you can lose the weight and keep it off, and you can stay healthy and do all the things that you have planned to do. Like, everybody has all these great goals, but y'all, you cannot do it without your health. Your health is your wealth. And in order to maintain your health, we have to do those key things: eat healthy, exercise, go to the doctor, do our screenings and our prevention. Do y'all know how many women came into my office last week who have not had their mammograms, who have not had a pap smear in 2 or 3 years, who've never had a mammogram, and they're well over 40? So make sure you're getting those screenings. Make sure you're doing what you can for prevention. Go to your doctor appointments every year. See your gynecologist once a year. See your primary care doctor once a year. And if you're at that age where you have developed high blood pressure or any form of heart disease, see your cardiologist on a regular basis, because we want to keep you alive as long as possible. And the only way we can do that is to live that life of total wellness, which is not easy, and which is why we're here at Me Bella Wellness Center to help you do it. So monitor your blood pressure, monitor your blood sugars, monitor your cholesterol. Go get your screenings for heart disease. Make sure your blood pressure stays less than 125/85. If you're going to a doctor right now who's telling you it's okay to walk around with blood pressures of 150s/90s, you need another doctor. If they're not recommending that you get your normal screenings, you need another doctor. All doctors are not created equally, and all doctors don't care equally about every single patient that they have. So make sure you're choosing doctors who care about you, who take the time to make sure you're getting your screenings and doing the things you can do for prevention, and then treating your concerns when you go into the office. So I know I haven't been on here in a long time, so it's a lot of stuff I need to say. I'm not going to say it all today. I will see y'all later on or tomorrow, but we're trying to protect the heart. It's the number one killer in America. And I have discussed the things that we can do in order to do that. So make sure you choose a few of those things to focus on today. Go schedule those appointments. If you haven't done your gynecology appointment, your cardiology appointment, or your primary care doctor appointment, if it's not scheduled for the year, go schedule it today. It's Dr. Mia at Me Bella Wellness Center, where our goal is to help you live well, so that you can age well, and so that ultimately you can experience everlasting intimacy. I hope y'all have a wonderful rest of y'all's day. It's Dr. Mia. I'll see y'all soon. Bye.